I think now would be a fine time to do that. I'm also going to put some information into the chat here about captions. All right. Well, thank you all so much for joining us. Today we're going to be talking about preparing data that you're working with for spatial linkages in research that deals with secondary health data sources. My name's Jamie Reese. I'm with the A.J. Drexel Autism Institute. Some of what we're going to be talking about today are methods that I use in my work, particularly when it comes to contextualizing data related to autistic individuals. We work with Medicare and Medicaid data, and we also do some primary research. And I will hand it off to Steve or Dan to introduce yourselves.
Hi, I'm Steve Melly. I'm a GIS analyst at the Urban Health Collaborative at Dornsife School of Public Health. So I'm really available to help anyone at Dornsife with GIS issues, spatial analysis issues, and we've done many projects, but some of which have involved electronic health records. We're collaborating with CHOP.
And hi, I'm Dan Vader. I work at the Biostatistics Scientific Collaboration Center. We're in the School of Public Health. And we work very closely with the Autism Institute on a bunch of projects, including phases, ERA. And I do all sorts of stuff with lots of different partners, but one of my primary interests is EHR. And with that often comes doing some of these spatial linkages that we're going to be talking about today.
All right, and I also want to acknowledge Anika Islam, who is on our team. She did some good research that helps with some of the secondary data information that I'm going to share with you later. All right, Dan mentioned phases. This webinar is presented by the Phases Data Core. Phases stands for Public Health and Autism Science, Advancing Effectual Strategies Across the Life Course. That's part of an Autism Centers for Excellence Award from NIH. The data core within Phases is a collaboration between the Policy and Analytics Center at the A.J. Drexel Autism Institute, which is what I work within, and the Biostatistics Scientific Collaboration Center, which is in the Dornsife School of Public Health as well. This is led by, or co-led, I should say, by Drs. Renee Moore and Lindsay Shea. So what we would like to accomplish today is we would like you to be able to understand when and how you can use spatial linkages to bring in secondary or external resources to your research. We want to help you be able to recognize what it takes to put information on a map. And we want to talk through some considerations related to documentation and what might be compatible, and then also getting into some security and privacy considerations. For those of you who are on, this is the second piece, a follow-up to a webinar that we did back in May. You don't need to have watched that webinar to keep up to date. If you would like to, it's available on our website. Excuse me. I am sick today, so I apologize in advance for my frog in my throat. But I used this example in our last webinar. This is one of those cases where I had mentioned working with Medicare and Medicaid data. We wanted to understand how the individuals in our data were distributed related to health professional shortage areas, which is a designation by HRSA. It indicates that there's not enough primary care or dental or mental health providers in the area. We have data in Medicare and Medicaid, that's by zip code. The health professional shortage areas are available and they're in their own geography. So in order to make those two data sources work together, I put them on a map and I joined them spatially. I think this is an example from Steve.
So in some cases, the exposure you might be interested in might be something that's not tied to an administrative boundary, but is something that changes gradually through space. In this example, it's violent crime incidents within 400 meters in Philadelphia. Another example that people might do would be air pollution exposures. So if you have the actual locations of your participants, you can link them directly to the place on these exposure surfaces and get the exposure values for each participant.
Is this Steve as well, or is this
I think I added the slide.
Dan? Sorry.
Yeah, no, that's okay. Apologies for the mix-up. But just wanted to highlight to kind of like get folks excited about like all the possibilities that there are for kind of bringing in other data to sort of enrich the data sets that you have. Is that like there's really a ton of different things that you can do. So like we might be talking about a few examples here, but there's like the reach of what you can kind of bring into your data set using these spatial linkages is really big. So you might think about like weather-related data. You might think about environmental contamination or environmental disaster. You might think about policy changes and like how those relate like geospatially to people, access to green space, rent and housing costs, and just a whole bunch of other stuff.
All right. Are there any questions so far? I want to pause there. Okay, just as a note, so we have Q&A open, we have a chat, and then also you can feel free to raise hands. We're gonna be walking through a process, so anytime you have a question, there's no need to hold it. We can always pause and talk through it. So let's talk about when this kind of method might be able to help you. When there is, and I think the Medicare, Medicaid, and health professional shortage area example that I gave earlier fits this description. There's no common variable, there's no common key between the data that you're working with and the external data source. Or there is a common variable, but it's not going to meet your needs. The example that I use for this is often we'll have data that has like a state, but if your information is more granular than that, you want to get a better understanding, then joining on state is not going to meet your needs. There's two overarching things to keep in mind. One is that they both need to be able to be drawn on a map, and then the other is you just need to be sure that there is spatial information in common. So we're covering the same area, or at least some of the same area. In order to go through this activity today, we're going to be talking about two different file types. One is tabular, that's something that would look like an Excel spreadsheet. One is spatial, that would be something that can be drawn in software like ArcGIS. There's different file extensions that you might see for each of those examples, but I've given you a few here. So when you have tabular data, so the one that looks like an Excel spreadsheet, and as opposed to spatial data that can already be drawn on a map, there are steps that would need to be taken in order to have the software understand what you're asking it to do. In examples where you're looking at like one specific location, the software needs to understand latitude and longitude. The most common being an address. So that'll go through a process called geocoding, which we're going to talk about in a few minutes. If you are looking to bring in something that looks like a shape on a map, so a political boundary or census tract, things like that, then you'll need to be able to join based on some identifier. With the census, you'll see GeoID or you'll see FIPS. And so having that field in common is what allows you to draw your data on a map.
So to bring an example of this, of like different kinds of data, we have electronic health records, and these are going to be in sort of what you'd think about as that tabular format. So they'll have the addresses, and addresses will relate to some place that you'll geocode it to. This particular example is from a paper that's looking at the impact of PFAS, which is an environmental contamination, on different health outcomes among folks in the Penn Medicine system. So it's using electronic health records from Penn Medicine to figure out how this environmental exposure might be related to negative health outcomes. And what's interesting about this map, just from the electronic health records perspective, is that we see that there is a particular geography around where people are coming from to be put into the data set to begin with. So even before we start bringing in this other data, geocoding these addresses can be helpful for us in understanding our patient population. Next slide, please.
All right, so to provide an example of external data that we want to bring in, and this is what we're going to be using as we go through some sort of a process a little bit later on. We look at the area deprivation index. This is a really interesting data set that is held by the University of Wisconsin. That measures neighborhood disadvantage. They incorporate a number of different indicators from census data. They construct this index and then they assign a percentile rank to each block group in the country. And then that's the value that you'll see in the block group. They also have it available at the state level, which is, I think, decile instead of percentile, but it's the same concept.
So Jamie, sorry, not to go off the cuff here, but just like thinking about the things that you just said earlier about things being able to be put on the map and being overlapped. I just wanted to point out that like if we wanted to put these two data sets together, we could do that because the Penn, like even just looking at the data you have here for PA, the Penn data set overlaps with this area deprivation index data, even if it might be a subset of that. So that's all.
That's great, thank you. And so the first thing that we'll start to think about when we're using an example like this is whether, we're going to go back to those ideas of whether it makes sense to use a spatial join. In this example, they're both in a tabular format, which means that we'll need to take into account how we might process that information. Dan talked about geocoding. Area deprivation index has a block group. It's not a spatial data set that you download. So you have to join based on the block group. And then we need to look at whether we even need a spatial join. And the way that we do that is to compare the variables on each data set. So if you take a quick scan through what's in some of the fields on the electronic health records, and then in the area deprivation index, you can see that there's not a one-to-one, with the exception of possibly street address if you reliably had 9-digit zip code on every record, which I don't know, Dan, if that's the case, but I highly doubt that that's the case.
Very unlikely.
Yeah, usually we just have a 5-digit at best. So because of that, we know that we would not be able to do a table join, but it would be helpful for us to consider drawing this on a map. Here's where we're indicating what geographic information or spatial information is there. And you can see these are sort of our options for drawing that onto the map. All right, before we get into some discussion, I just wanted to check in again. Are there any questions at the moment? Okay. So for the next section, we're going to be talking through a process for you to assess opportunities for yourself, for your own work. And we're going to be posting questions to answer. I just want to note this is not a quiz. There's not like correct answers related to this. This is for you to practice using this framework. And it's also because it's always interesting to hear ideas from others that are doing similar work. If you are not so sure where you want to start, you can always come back to our example of electronic health records and area deprivation index. So the first thing, we just wanted to invite you to enter into the chat. What are some data sources that you think you might be interested in combining? And if you brought an example with you to think through for this process, feel free to share that, projects that you're working on, or external sources that you're interested in. I'll give a minute. Oops, I think I just skipped ahead. There we go. Nice example, Dan. Hospitals to some economic area information from the census. Yeah, I like that too. Census information is kind of a real gold mine when it comes to contextual information. And a lot of times it really is just a matter of being able to place things onto a map. Okay. So from here, let's walk through some of those other questions. Whether you're discussing or whether you're considering our example or your own work, I have a poll set up here. I just wanted to get a sense of what people might be working on. So either with the EHR and ADI example or with your own work, how would you describe your scenario? Either there's a common variable that's going to meet your needs, or there's one and it doesn't meet your needs, or there's no common variable at all. I'm going to give it a minute. All right, it looks like. So it's a split between there is a common variable that exists and it does meet your needs, and there is no common variable. I have good news for the first group, sort of. The good news is that you don't need to use a spatial join, so you would not need to go through this process. The bad news for you is that you'll need to just come with us and use our example for the rest of the webinar. But the no common variable example is where we would start to consider the rest of this process. Next questions.
Sorry, Jamie, what would you do if you had a common variable? I realize this is a little bit of a gimme for some folks, but yeah.
Good question. Yeah. So you would do what's called a table join. So you would use that variable as like what we call a common key between those two data sets. So it just matches them up. I am new to polls, so I'm figuring out how to launch the second piece. Okay. Do we see two more questions as a poll? Does anyone not see two more questions as a poll? All right, so we want to think through from here what can be drawn on a map. We'd like to ask this question for both the research data, which if you're using our example is going to be the electronic health records, and for the external data, which if you're using our example is going to be the area deprivation index. So the choices are going to be you either can't draw it at all, you could draw it by geocoding, you could draw it by joining it to something like a shapefile, or you could draw it because it's already in a format like a shapefile or a geodatabase, and you can bring it right into a mapping software. So I'll give you a minute to answer that question. There are those two questions, I should say. All right, interesting. So it looks like in this group we have we have some working with points, so yes, by geocoding. And we have some working with that are actually already working with something that you can load into something like ArcGIS. So a shapefile or something along those lines. So thank you for that. I'm excited that there's a couple different scenarios here. In our example, geocoding again is the electronic health records. And thinking back to area deprivation index, when we say joining to a feature, what I mean is matching up that column that has the census identifier to the shapefile from the census that will have the identifier in it as well. All right. Any questions so far? All right, from here, we're going to do a little brainstorming together. We have some topics to talk with you related to this, but I wanted to hear from you some ideas that come to mind when you think about what is or is not compatible with your own research data. So what would tell you that this might be a good match versus what might not be a good match? And you can enter that into the chat. Similar time periods. Yes, that is important for sure. All right, let's talk through some of the things that we think through in our work. I've given you two examples here that I've encountered. One of them is, so I'm saying definitions and limitations, but really just going through your documentation. Anything that you can find from that external data source to make sure that you understand what you're looking at and when it's appropriate to use it in the way that you would like to use it. A lot of times you'll download data from an external source and there will be multiple variables that have information that looks the same, it's in the same format, and it's the same concept. So in this example, there's like 4 different places in the HPSA data where state the value in that variable is going to be state. If I were to join based on state to my research data, it's very possible that I'm joining to the wrong field. So I just want to really make sure that I'm joining to what I think I'm joining to. On the limitation side, there's actually some really interesting methodology stuff around this. So there's an urbanicity indicator from USDA. It's called Rural Urban Commuting Area Codes. They necessarily changed methodology a little bit over time to account for some differences in the data that's available. Someone wrote in the chat about timing. This is a really good example. When we go and think through electronic health records as the project data, area deprivation index as the external data, when it comes to timing, we have to think about the sort of alignment between the two. So when it comes to area deprivation index, there's 3 versions that are all available for download on their website. There's 2023, 2020, and 2015. And then if you look at in parentheses, that tells you, remember I mentioned that census data goes into that index. So they take these measures from the census data to construct the index that you're looking at, and the census data has its own timeline as well. So the 2023 version of the ADI is going to use 5-year census estimates from 2019 to 2023. So when it comes to connecting it to your work, in a data set like electronic health records, which are collected continuously, you're probably starting, and Dan, feel free to jump in if you need to, but you're probably starting with your research question and saying, this is the window of time that we're going to be looking at. So you have more flexibility on the EHR side than you have on the ADI side. So you just want to make sure that you are in alignment across those two. Similarly, you might have different versions available. I talked a little bit when it comes to ADI about how there's like a national version and a state version. You'll see in the state version values for both of those. But the other thing is that the methods will be updated occasionally. And this is where I really want to credit Anika, who I mentioned as a contributor at the start of the webinar. There are updates for each of these versions and even between versions where they'll be looking at, for example, they changed from phone access to internet access a few years ago to better reflect the needs of the community. They needed to account for census block groups being drawn in 2020, which is something that happens every 10 years. And there are ways to get at the historic like boundary changes, but that is something that you have to account for. And then even sometimes when you see these different versions, you'll see a different construct or a different value altogether. In the earliest versions, they had a raw score. In the later versions, they had the percentile score. So you'd really just need to dig into all of that. All right, and we have another one. This topic came up quite a bit in our last webinar. So we wanted to give some space to brainstorm security and privacy issues that might come into play. Also, I keep saying enter into the chat, but please feel free if you want to raise your hand or just unmute. This is a pretty small group, so we have plenty of space for discussion. All right. Dan,
Okay.
I think this is where, yep.
Yeah. So now you get to hear from me about all the stuff you should be worried about while you're doing these things, because I think one thing that's like, if it's these spatial linkages are really cool and exciting and fun, and they enable you to do a lot of really interesting stuff, but sort of along with that is a certain level of risk, because geospatial data are highly identifiable, especially if you're dealing with addresses or point data. So usually there's a lot of things that go into, there's a lot of work that goes into like maybe making a contract with the person that with the entity that you're getting the address information from, if you're working with data that have address information. And there's all sorts of rules that you want to follow on your side to make sure that the data that you have, identifiable data that you have, are not being exposed to people who should not see them. So some things that we might want to think about, like during data acquisition and management, are, according to our contract and IRB, where are we allowed to store the data, who's allowed to access it, and what are the permitted use cases. So all of that stuff should be in your contract, and you should have figured that out with IRB. One thing that I do see sometimes is, for folks who don't do this a lot, is sometimes the language in your contract or the IRB might be vague, or more vague than it should be for the project that you're working on. So something to consider when you're setting things up is to make sure that everything is really clear, so there's not sort of this ambiguous space where mistakes can be made or blame can sort of be passed around from one person to the other. The other thing that comes to mind when thinking about compliance during the analysis process is thinking about how your geocoding software works. And this is something that came up during the last webinar, as Jamie said. So one thing that geocoding software can do, so you might be using like ArcGIS, you might be linking into Google Maps or OpenStreetMaps or some other database. When you link into those databases, you need to know if the database that you're accessing is online or if it's on your local machine. If it's online, you might be potentially exposing your data to a third party that's not allowed to see those data. So you'll find all these like cool little packages and stuff in R that are like, hey, you just run this package and we'll geocode this for you using like your Google Maps API or OpenStreetMaps. That might not be permitted under your data use case, like under your data use agreement, or might not be a good idea given the sensitivity of your data. So something to consider that I think that people often miss. And finally, after the data are processed, can you drop more sensitive information from the analytic data set before passing it along to other team members? So there's always this sort of, with data security, there's this principle of least privilege where only folks who need to have access to the most sensitive data should have access to it. And once it's sort of like those folks are done with it and it's ready to move on to the next step, we need to drop everything that those folks don't need to have access to reduce the risk of data exposure. Next slide, please.
So when Dan was talking about the geocoding with an address located it's on a cloud, one of the things I wanted to point out to people is that because Drexel has a site license with Esri, which is the leading software company that does GIS, we have access to an address locator that can be downloaded and saved on your local computers. The downside is that it's large and takes a little while to do that, so you're not going to want to do it like and be ready to do it in 5 minutes. But it is, all the work can be done locally. You can keep your addresses on a Drexel network and the address locators in this within the network too. And then the other advantage of this is that this version that you've downloaded is going to be the same and it will be reproducible if you do it a year from now. Whereas if you're using an online service, they're always trying to improve those online services. So there might be some changes in that.
Okay, and so say you finished your sort of like initial data processing, you've geocoded everything and you've done it in a safe way. You've used sort of like this offline database that you've downloaded so that your work is both kind of protected and reproducible. But you're ready to like publish a paper about this. You want to like put some maps online or something and start talking about your work. When you're doing that, it's important to consider that a lot can be inferred from a point on a map, or even maps with regions with small sample sizes. It's pretty easy from a point on a map to either just through eyeballing it or using a computer program to sort of figure out approximately what like the latitude and longitude is of the person that that point represents. So given that information and given what other information you might have on the map, you might be sort of revealing the identity of people in your study, even if that's not your intent. So it's something to be really careful about. So just consider that the smaller the cell sizes are in across tables. So if we're thinking about tables again, the greater the risk that data can be re-identified. And then we also want to think about, when we're thinking about this, what is the acceptable level of risk set by your data use agreement or your IRB? And do you believe the rules set by these regulatory tools are sufficient? So again, I want to emphasize that IRB and DUA's data use agreements are there to kind of make sure that everyone's on the same page about the rules. But sometimes those tools are imperfect for getting us to a place where we're treating the data with the respect that it should be, given that it represents private information from individuals a lot of the time. So I think it's important not just to follow your contract, but to also think critically about what you're doing in your systems for things that might not be sort of like explicitly covered in that contract. Next slide, please. Thanks. So just an example of like something that you might do to anonymize things. This is from a presentation given by the National Energy Technology Laboratory. From the US Department of Energy. So on the left, we have like a point map, which maybe reveals a little bit too much information. This is pretty zoomed out. So depending on what's showing, like you might be less concerned about this than something else, but still we can probably do better than this. One tool that they have here is they've sort of anonymized things by grouping them together and showing like vaguely where people are coming from. So it still communicates the information that they're trying to talk about in their paper without revealing the points where each individual or like each kind of like observation is coming from. So there's a lot of different ways that you can approach this sort of thing, this kind of like introducing information, introducing de-identification or like kind of informational noise to make sure that these points, this like geospatial information doesn't become identifiable to the folks that you're disseminating things to. And since this is something that I'm a little bit less familiar with personally, I just want to check in with Steve and Jamie if they have anything they want to add to this or correct for things to be careful about. Okay.
Yeah, there are a variety of different ways that you can do similar things of sort of anonymizing your points. That's the whole sort of area of literature.
What's your most frequently used, like your favorite? Do you have a favorite one that you use?
Well, we probably usually like just display things at some like a zip code or a census tract level, and then mask the census tracts with under a certain number of cases.
So you'd basically put like counts or rates in for like a certain geospatial region, and then summarize things that way instead of doing a point.
Right.
Okay. Okay. And finally, the end of my fun section where I tell you all of the rules is documentation. This is really, really important, especially given all of that stuff that Jamie talked about earlier about sort of like thinking about like all of the different pieces that need to come together in order for us to be able to kind of like join these data sets from one another, including kind of situating both of the data sets in time in the right way and making sure that we can reproduce the ultimate data set that we're creating. Because this is like something of a complex process, it requires a lot of documentation to make sure that we are ensuring the rigor and reproducibility of our work. So like we don't want to like geocode everything and like later on come back to you and being like, I have no idea how we did that. Oh well, it's a mystery. Our paper is out, so this is fine. We want to be able to like actually reproduce the things that we did. And that's really hard when you're doing something complicated. So documenting every step of data processing is critical to conducting rigorous and reproducible research, especially when working with geospatial data. And we want to think about all the decisions and work that go into this process. So some questions that we might not want to have the answer to readily accessible are, would we be able to recall with confidence every one of these decisions? So each time you're like, okay, let's use like this version of the data that we access from this particular source that covers these specific years, and we'll match them with these years from our other data set because this reason and that reason. Like we want all of that information down somewhere because no one is going to remember all of that. Or even if there is someone on your team who could remember all of that with clarity and confidence, they might not be with your team forever. So you want to have that written down somewhere so that your work can be reproduced. And yeah, and again, like if you weren't available or if the person who knows this wasn't available, would someone else be able to go in, look at the documentation that's available and figure out what happened without direct guidance from the person who wrote that documentation? And there's this really good figure here from Jamie that talks about like all the things that we might want to think about when building this documentation in these different stages. So variables and file types, the version, vintage definitions, and compliance stuff for assessing things, and then reproducibility, format, and censoring suppression, all those decisions during preparedness. We have a really good question in the chat from Goldie that asks, how do you document this? Do you use particular tools that you'd recommend for that type of documentation? So I'll talk a little bit about my process, and I'm sure that Jamie and Steve have like maybe a more that have a different or maybe superior process than what I have. I do a lot of stuff through like my first line of documentation is often through code because I work with code a lot. So I write a lot of comments in my code. I usually have a README file that goes along with my code that lets like whoever's accessing it know exactly what each script does, and each section of the script has a description of what I'm doing in that and why. And then I'll usually generate a report at the end of that. Like that's usually just for internal purposes that will summarize all of the data and then talk about all the decisions that led to the tables that we have for that. And then sort of after the fact for that stuff, I'll usually put together some like big document that like organizes this in a different way. But like for ongoing note taking, I often do it in the code. And Steve just posted a resource in the chat. Would you like to talk about that a little, Steve?
So there are US standards and international standards on metadata for spatial data. And the Esri software does have tools to help you complete those. As Dan said, that like it's really important with spatial data because if you don't have the metadata, sometimes you don't know how to align it with another set if it's not ready to go. Those are tools that you can use. And then as we are sort of also like trying to work more with people who are coding like Dan. So as we've now moved towards using Jupyter notebooks for Python scripts, so that's how we've been documenting the scripts in Python. And then like often we'll be sharing them with somebody else who's maybe working in R or SAS.
Yeah, and one thing that I really like that's really interesting to hear, Steve, because I'm not as heavy a ArcGIS or Esri like stuff user as you and Jamie are. But one thing that I really appreciate about my coding first approach for a lot of things is that I know that when I click the button for my code, I'm going to get the same thing every single time. Whereas there are some software out there where if you're using like a really menu-based system for doing your work, it's not guaranteed that like everything, your output from that is gonna like all of the decisions that you made during that process are gonna be saved in a way that's like readable. So I'm sure you have a really good process for doing that through the like Esri suite, as you were describing.
They also have a way of saving a model that's sort of like a macro, if you're familiar with other software. So you don't have to actually know the coding to save your steps in a way that could be shared with somebody else.
That's really cool.
The one thing that I can add on the documentation side, Dan, I am similar, like when I put my code together, there's so many comments. And I use Markdown, so a lot of times like every decision that's ever been made is always in there. But the other thing that we have started to do within the Policy and Analytics Center, the data team, is to put together what we're calling resource guides. So data sets that we use, that we have available as a resource that can be used on different projects. We have sort of a standard set of information that that will consolidate so that people always know where to find that. And that's going to include where did it come from? What does it mean? When we chose, you know, this indicator over that. And that has to do with either, it could be within that specific data set, like why this version, why this year or whatever. But also it can be, why did we choose this data set over that data set? So it's less on the technical side, but more on the side of just making sure that that information is available to everyone that could be using it.
Yeah, yeah, and that like decision tracking process is like so important. I'm sure you have all also had this experience where like you're putting together the final manuscript for a project, or you're like putting something together and you're like, hey, what did we do? Like with like why did we do it this way specifically? This seems like ridiculous. Why did we do it this way? And usually like oftentimes like it's something that you like deliberated about for hours or like worked on for a really long time before making the decision. But sometimes that decision doesn't get noted in a place where you can then revisit that conversation that you had. So it's really important, and it does save a lot of time in the long run.
Yeah, thanks for the question, Goldie. Excuse me. From here, we have a number of resources and learning opportunities, starting with this event that Steve will share.
Yeah, so this is my plug for our GIS Day on November 19th. It's going to be at Nesbitt Hall, but also by Zoom. And I think we're going to share these slides. So the links here will be a place where you can see you can get the Zoom link. It's not currently set up yet. Or you can subscribe to the UHC newsletter to hear more about events. So this is actually it's the week in November that's set up by National Geographic as a Geography Awareness Week, and the Wednesday of the week is GIS Day. So it's not just us. But there are typically other events going on in Philadelphia, like at Temple and at Penn. So if you're interested, you could look into those. Next slide. So we have at the Urban Health Collaborative, we have a bunch of data that we've compiled. A lot is focused on the Philadelphia metropolitan area, but a lot of it's contiguous, the US wide. And then a subset of that is actually available online in this UHC data portal. You do have to sign up to get access to it, but that's an easy step. The last link is a way to get to the sign up of that. And a big advantage of this, when Jamie was talking about the census data, is we've already compiled this. The census, if you download it from the census, comes as counts, and that's not as useful as if you have like percents of people below poverty. So we've already compiled a bunch of measures in percents and in formats that would be convenient to use in health studies. So that's a big advantage to using our data. Next slide. This is so as I said, the Esri software is available at Drexel through our license, so you can request access to it through this Drexel IT link. There's a desktop version that's really good for work, really doing customized work of maps and to do the kind of geocoding that we've been talking about. And then there's this online cloud-based version that's a good way to sort of explore data and without having a big learning curve on it. So those are both available. This community analyst online, and I also had mentioned the business analyst data that we're downloading, that there's a business analyst online aimed more sort of businesses. That's a place for information where you could get like demographic information around locations and information about types of businesses and organizations. So that's really interesting and valuable. And there is a library guide that the library has put together that has some links and some of the same information about how to get access to these things. Through the Drexel license, we have access to any of the Esri trainings that require the maintenance program. A lot of the Esri training, the web courses are also free to anybody. So I would encourage you to take a look at those. I really think that like even just like spending a little time to learn about it is valuable. You don't feel like you have to spend, learn everything there's to know about it. That will take forever. But even just scratching the surface is a good way to sort of begin to be able to explore spatial data and work with other people on your team who are working with spatial data. So I had like highlighted some of the courses that I thought might be useful for someone starting out here. The Urban Health Collaborative also does in June a summer institute, so a week-long program. And well, there's several courses that we offer, but one of them is an introduction to GIS. So that's another way to get a quick introduction to it. So look for that next June. I think that's all I've got.
That's right. So just a note here that this work is funded by the Phases project that I mentioned earlier, which goes through NIS, and then the slideshow, or this slide is some acknowledgement about that project. So we'll open up for Q&A, and then I also just want to plug, we have a survey that you can access either through this QR code, or I will paste the URL into the chat. We do read every response, so your feedback is really well appreciated, and some of the responses from the last one informed this session. So it is worthwhile if you have time to fill it out. We really appreciate it. Okay, other questions, discussion?
Thank you all. I'm not seeing any in the chat, but I did have a question. I know we were kind of looking at more like overlaying two pieces of data, but does ArcGIS support more of like a travel distance between points? So if you were looking at person to nearest hospital, and not so much like how the bird flies, but how they would actually get there.
Yeah, so you can do that. You can do network distances like along a street network, and they do have travel time data that's sort of aggregated, like, that's not like Google where it's real time travel time. It's like, however, like the past 10 years of travel time. So I would take that with a grain of salt, but it is sort of useful. So we've done things like 15-minute drive times to different places within Philadelphia.
Great, thank you.
Okay, well, if there are no more questions, thank you again for joining us. I hope that you have learned a fair amount, and that you found this interesting. We will follow up with some information. Steve, you mentioned distributing the slides. And then the other thing is, if you have questions, or something comes up you think of later, we had in the sorry, in the registration, my email address is in there. I'm always happy to answer, or to connect with you, or to connect you to someone who would know the answer to your question. So with that, I would say, Meredith, we can stop recording, and thank you all, and have